welcome to the Wellness Clinic. Do you know what this initial meeting is for? Was it explained to you? Right, okay, so, well, you know a little then. Basically, what today's meeting is about is to get a baseline to find out where your pain levels are. Yep. Okay, so what's going to happen is we will be doing an initial assessment, and then once I have done that, I'll be contacting my colleagues and we'll have a clinical assessment to decide whether we can offer you the care here or refer back to your GP for further in-depth assessment if that's needed. If we feel that we can provide you with care here in our wellness facility, then we will create a specialised regime just for you to help with your pain levels. Well, we have many different treatments available here. We have occupational therapy, we have cognitive behavioural therapy, we have reflexology and massage, things like that as well. But we also have more in-depth, we have brain therapy, stimulation, light therapies, which we have tactile therapy. There are many different therapies that we provide here in order to help you be able to control your pain levels and to be able to lead as well a life as you can. Yeah, I completely understand that. Okay, so if we can get started, because I can see that you're uncomfortable already, so I can get you some more cushions or... Okay, right, you just want to get started? That's fine. Right, so the first part is a checklist, which I'll be going over now. Now, I can't take any other information other than what the questions are, because this is for your pain levels. But the second part will be a more in-depth look at your health, and I'll be able to take down some notes if there's some other information that you want to tell me. Okay, so I'll just get started here. Okay, now I need to bring this up, and every time I do it, it crashes on me, so if you could bear with me. Yeah, computers don't really like me very much. Alright, so now if I could just bring that up. Okay, so now, right, okay, so just get a fresh checklist. Okay, so on a scale of 1 to 5, 1 being the most severe level of pain and 5 being the least to not, can you tell me where on that scale you would experience a flickering type of pain? Right. Okay, and what about quivering? Okay. Pulsating? No? Okay. So that would be a 5. What about throbbing? Right. Okay. And pounding? Right, okay. Do you experience one of the 3 or all of the 3? Jumping, flashing, shooting? Okay. Right, now what about on a scale of 1 to 5 again? Prickling? Yeah, okay. So what was that, sorry? Right, okay. And boring? Yeah, I'm not quite sure what that is either. I think it's a kind... No, well, the next one's drilling, so it can't be that. Well, so I'll just put 5 for those then. That's fine. What about stabbing? Right, okay, so put 2. And... okay. about lancing? I'm not sure what that one is either. So I'll just put 5 for that again. Right, okay. And the same for pinching, 1 to 5. Right, okay. Pressing. Okay. Gnawing. I think that would be like a kind of chewing sensation, as if something's maybe chewing at you, like maybe your bone or something. I'm not. Right, so you don't have that. Okay, so 5. All right, and cramping. Right, 1. Okay, right, that's fine. Crushing sensation. Right. Okay. Do you experience tugging? Yes. Okay. What about pulling? No. Okay. Wrenching. Right. Okay. And is it a kind of hot pain? Right. What about cold? Do you experience? Right. Okay. So you can get both on and off. I can't really answer that there, but I can write that down in my notes. So experience both hot and cold pain. You'd think they would have a section that I could just add a wee extra text box. Right, okay, back to it. Okay, is it kind of scalding? Because you said that there's the hot pain, but is it like you've been burnt by like hot water? No, okay. What about searing? Yeah, I think that falls under the same bracket, but okay, so that's no as well. Okay, and do you experience any of the following? Tingling? Yep, okay. And itching? Yep. Smarting? Yep. And stinging? Yes, okay. And on a scale of 1 to 5, is the pain dull or is it very sharp? So where on that scale would it be? Right, okay. And what about heavy? Do you feel heaviness? No, not your weight. I mean, do you feel like a I guess similar to the pressing question, but more weighted down with the pain? Right, okay. Do you feel tired and exhausted? Yes, okay, so fatigued, yes. Okay. Does the pain feel suffocating? Right. And does it make you sick to your stomach? Okay. Does that cause diarrhea? Do you vomit? Not because you're sick, but because of the pain? Okay, I'm just going to note that down. Okay. Now, let's get back to questionnaire. Oh, okay. Now, is it a spreading? Does it radiate out from one area or is there many areas? So it's, yeah, okay, so it spreads out, radiates out. Okay. Do you have any numbness? No, okay. What about, right, okay, what was the next one? Is it a bearable? Well, I suppose you wouldn't really be here at the pain clinic if it was a bearable pain. Mm-hmm. Right, okay. I can't imagine what that's like. Okay, so what would you put that on a scale of then? Right. Okay. Now, does the pain kind of come and go? Yes. So is it rhythmic? Does it have like, you know, do you get it more in the morning? No. Okay, so it's just throughout the day. So I guess that would fall under intermittent. So, yep. Okay, but you do have a continuous undercurrent of pain. Okay. Right. Okay, I think that's just about done here. Now, see on the external, on your skin, is there more pain on the external area or is it more internal? Okay, so it's a bit of both. So yes and yes. They really didn't design this very well because, again, there's no text box for me to add that in. So both equal levels of pain. I'm actually going to speak to them about this. Okay. I'm really sorry about that. Okay. So now I can get into your document. Right. Okay, so can you give me your full name and date of birth, please? And birth. Okay. And your address? Alright. Is it quite nice there? You've had a wee bit to travel to come here then. No wonder you're sitting there feeling uncomfortable. If you've been sitting for over an hour. No, I haven't been. I don't tend to go up through that side of the city. I don't really get out too much, unfortunately. If I do, it tends to be Edinburgh that I would go to rather than Glasgow. But I have heard it's nice out that way. Alright, okay, and who's your primary care physician? Okay. Okay. Now can you give me an emergency contact? And I'll need an address for them as well. And a telephone number. Okay. And your relationship with that person? Right, okay. Okay. Now, can I have your phone number as well? Is your mobile number? You don't have a house phone? It seems that a lot of people don't have house phones these days. I suppose why would you when mobile? Sorry, I've lost the last 3 digits of your mobile. Can you? Right, okay. That's fine. So yeah, no. I still have a house phone, but I think I'm going to get rid of it because I'm just not. The only people that seem to contact me are telemarketers, and I don't really want to have those phone calls. Okay. So, here we go. Has your doctor... I'm just take some notes on this as well, because there are small text boxes here for me to fill in, but I do prefer some handwritten notes as well. So has your doctor ever denied or restricted your activity levels for any reason because of your levels of pain? What that means is basically, has your doctor says to you, for example, that you have to stop driving because of your degenerative pain? No? Okay. Okay, and do you have any other ongoing medical conditions? Right, okay. Do you take medicine for that? Any medication? Okay, even ointments, that's fine. Right, okay. Right, okay. And have you been hospitalised in the past 12 months? No? Oh, it's good to hear. Have you had any surgery in the past 12 months? No? Okay. So have you been treated for any psychological problems? Right, okay. And were you medicated for that? Do you remember what it was called? Right, okay. Well, we'll request your medical notes over here anyway, so I'll be able to get that information when it comes across. Okay, so do you have any allergies to any medication, even if it's over the counter? No? Okay. In fact, do you have any allergies to anything? No? Oh, that's good. Well, I'm allergic to dust, so it's a pain when I'm trying to do my housework. But then again, most people are allergic to dust because it makes them sneeze when they're cleaning. Yeah. Okay. So have you had any pain or discomfort after you've eaten? You know, in your abdomen, whether it's directly after you've eaten or a short period of time after you've eaten? Okay. Have you ever suffered from any types of seizures? Okay. Have you ever had an EKG or any other type of monitoring for your heart? No? Okay. What about an echocardiogram? Something like that? No? Okay. Have you had anyone in your family die and they've not known the cause of death? No? Oh, that's good. Has anybody in your family died under the age of 50 that was heart related? No? Okay. So everybody's still alive then? Right. Okay. Have you ever had to use a respirator? No? Okay. Do you have like a cough that keeps coming back? Uh-huh. No? Right, okay. No, I wouldn't think that that was what the question meant. Okay. So you don't have asthma then? No. Okay. Is anybody in your family get asthma or eczema? Right. Okay. Right. So you've never had to use an inhaler or anything like that? Now, if you didn't have asthma, then you wouldn't have had to. Have you had any infectious disease in the past 12 months? Whether it be sexual or not? No. Okay. What about any sores, rashes or skin problems? Something along them lines? Cold sores? No. Okay. Have you ever had been diagnosed with herpes? No. Okay. Have you ever had a concussion or a head injury? Okay. Have you ever been given an x-ray? No. Right. Okay, but have you hit your head? And were you concussed? Did you lose consciousness? Was your vision blurry or anything like that? Right. Right, okay. So was it a kind of numbing and tingling sensation then? Right, okay. And did you, right. But was there any weakness in like your limbs? Okay. Yeah, but walking up the stairs and having to hold on, that would be a kind of weakness because you're feeling like you're gonna fall back down. No, that's fine. Right. So did you get any lower back pain after that then? Right. So is this when your pain really started? No, it's right, okay, that's fine. And how long have you been in this level of discomfort? Right. Okay. And what about before it got this bad? How long have you actually been in pain for? Okay. Gosh. Okay. Now, when your pain's at its worst, do you get confused and disorientated? Okay, so sometimes. Does that depend on the severity of the pain that you're in then? So it's only at your worst points? Okay. Right. Okay. Have you ever suffered from a stroke? No. And you already said no to the heart problems. So you're fine that way. Have you ever been hospitalised due to exhaustion? Okay. Okay. Do you have diabetes? Okay. No. Okay. Do you have thyroid disease? Okay. No. Okay. Do you have any hormonal problems? Okay. Have you either lost or gained any weight since you've been in this level of discomfort? Okay, so you've gained a little bit of weight. Well, that's understandable given that it's much harder to do any exercise. Are you able to do any kinds of exercise? Okay, so you can do a small amount. It's better if you're sitting. Okay. So you don't have sickle cell anemia or anything like that? Okay. And do you calorie count? Right, okay. No, it's just because I can see you are looking a bit weak. But I can understand it would be difficult to partake of nutrition when you're in that level of discomfort. Okay. Yeah. Well, gaining some weight due to the pain and then losing it again that rapidly, that's definitely not healthy. But we have a nutritionist on staff that should be able to help. We can provide cans of Ensure, which are packed full of nutrition and will help put the weight back on you. Okay. Right. Do you have any concerns about the level of pain you're in, or really about anything? Right, okay. Okay. Is there anything that you wish me to discuss with the team when we're doing your clinical assessment? Right. Right, okay. Yeah, you see, one of the things that we do is light therapy, and yeah, that would actually be really helpful, especially if, with your migraines and that level of pain, I wouldn't then advise that you go for the light therapy, because when you're suffering from migraines and lights are shining in your eyes, it can actually exacerbate them. But we do other therapies or tactile therapy. We have massage on a masseuse on staff who does different types of massage as well in order to relax your body. But when we have, if it's decided that we can offer you help and support here in the clinic, we'll be giving you paperwork with all of the different classes and all of the different things that we can actually do here. But what the clinical staff will do is they'll sit down and they'll go over everything that you've told me about your pain and how it feels, and they'll create a specified plan for you, where you'll have, throughout the day, there'll be different meetings that you'll have with our staff and different therapy sessions as well. So there'll be things that you can do to help how you're feeling, but also things that the staff will be able to help you with. Yeah, we do. We have actually a hypnotist on staff as well. So you want me to speak to them about getting you that if you're accepted? I can tell you right now, by the level of pain that you've explained to me, we'll probably definitely be able to offer you some sort of help or support. Yeah, not many people get refused, especially with your pain levels here. It's just depending on how many patients that we're currently seeing, and if there's any staff shortages, if anyone's off on maternity leave or something like that. Obviously, then it might be a slightly longer waiting list, but we try to see as many people as we can. So I'll put down that it's slightly more urgent, with yourself here, and try and get you the help that we can. So we have a reflexology pool. So did you see that in the pamphlet? Yeah, it's lovely. Yeah. Yeah, we have a steam room and all that as well. Yeah. Well, no, the staff can use them, but it's at different times from the patients. And you're given a key card so that you can access anywhere, but the staff aren't allowed to mingle with the patients when we're off duty. So you wouldn't need to worry about that at all. Okay. So basically, I think there were about it. But what I'm going to do is I'm going to get all my notes printed up and I'll put them onto the system, into your file, and me and the staff will sit down probably on Thursday, and we'll have a clinical assessment where we'll go over everything that you've said, and we'll have your notes by then from your physician, and we'll be able to decide. As I said, we probably will take you on here as a patient, but we will then create a personalised plan just for you. You'll be allocated a worker who will help you through your day and let you know where you're going, especially since you need a wee bit of help mobility wise. But yeah, we can probably it'll probably be about 2 weeks, if I'm perfectly honest. I don't think there's any staff signing off anytime soon, but given where we're at just now, it'll be about 2 weeks probably before you are actually admitted into the clinic. Well, you can do both. You can be an outpatient or an inpatient. That's perfectly alright, and it's really up to you. It's your preference. Well, I would be an inpatient because it's more in depth. So from morning to evening, you have staff around to help you learn ways to cope with your pain. So that's what I would do. But I mean, it's up to you. It's your own decision about what would be better for yourself. All right. No, that's wonderful. It was really nice to meet you too. So a letter will be sent out to you, and it'll give you an appointment. So that'll be after Thursday. So probably get the letter about Tuesday. All right. Well, no, it was lovely to meet you. Thank you for coming in to see us. So I'm just so glad that we were able to fit you in short notice. All right. So you have a lovely day now. All right. Okay. Bye. Bye.